Okay, this is Mr. Demetrius Beatty. He is 39 years old. He's been a patient of mine for 6 years and has been on testosterone replacement since July of '07. Mr. Beatty really didn't have any complaints referable to testosterone deficiency at the time I first tested him, which was May of 2007. I guess I had a suspicion that he might be testosterone deficient. And indeed, his testosterone level at that time, again at the age of 38, I guess he was, came back extremely low. His testosterone level, his free testosterone level, was so low that if he had 500 or 600% more, it wouldn't be too much. And in July we discussed this finding, and we discussed his life. And why don't you tell us what your life was like at that time before you started the testosterone?
Well, I was inverted, shy, and actually I was kept to myself all day. That's how I felt.
It's sort of like being antisocial.
Yeah, almost antisocial. Don't want to go out.
Depressed?
Not depressed, but don't want to do anything.
And interest in women?
Well,
not much.
Not that much.
And how long, this is what's interesting, how long had you been that way?
Well, almost my whole life, almost.
Your whole life, basically. So you had never really had much in the way of, you were never hot about sex, never hot about girls?
No, not really, no.
No. I think that you're one of the people that I described in the video that I called post-adolescent testosterone deficiency, that you probably never ever secreted quite enough testosterone to become fully mentally and sexually mature. And I think there are millions like you, or maybe hundreds of thousands. But anyway, so in July of 2007, we started you on testosterone replacement. And what happened?
I got a little better each day and day. I'm starting to go outside a little bit. Actually talk to somebody outside. When the first time I had the shots.
Uh-huh.
And
as they progressed?
As it progressed, I was going out more, hanging out with the fellas now, and going out to movies.
More social?
More social.
And you're interested in women?
Oh, is there.
Much more. Big difference?
Yeah, much more.
Much more.
Much more difference.
I'm looking at the notes that I wrote after we started him on testosterone replacement. Even after one shot, he had told me that he had more energy, he felt more self-confident, and he had more of an interest in sex. And as the shots continued, this steadily increased. And he's really a different, I can see he's a different person. He talks differently, he acts differently, his whole affect is different. So this has made a major change in your life.
Yes, sir.
And it's persisted. You still feel good.
I still feel good.
And you look much better. Well, I'm glad to hear it, and I'm sure that people out there will be interested in this. So, thank you very much.
You're welcome.
Okay. This is Mrs. Edna Kearney. She is 75 years old. She's been a patient for 10 years. Mrs. Kearney has made another video about herself, describing what testosterone replacement has done for her. But today we want to talk about her grandson, who you've just seen, Mr. Demetrius Beatty. So, from your perspective, what was Demetrius like before he received any testosterone replacement?
Well, he was, I would call it introvert. That's someone that was,
right.
He wouldn't, like if he had a doctor's appointment or whatever, I would usually go with him because I figured he wasn't going to talk up for himself. And now, I don't have to, he'll tell me, Mom, you don't have to talk for me. I can talk for myself. And I see people that he interact with now. He's like me, he's all up in their face, where before he would kind of shy off from people. But now he's outgoing, and he's just a different person.
Different person. I would add that you've raised him.
Yes, I raised him.
You raised him.
From
And he was that introverted person his whole life.
Yes, he was.
Shied away from girls.
Yes.
And now there's a difference in that.
There's a difference. It's a very much difference in that.
So he's really become a different person.
Yes, he has.
Yes, I see it too. Even the way he talks to me.
Yes.
Instead of withdrawing as he talks, he comes forward when he talks.
Yes, that's what he
And
do.
it's a pleasure to see that change in him, isn't it?
It is. That's the way he do his people he talk to now. His friends he used to, like withdraw from. But now he's in their face. So it's good to see a change in him. And I mean it's a big change.
Good.
And he seems to have more energy, more get up and go about him. And it's been a big change.
I'm glad we were able to help him and change his life.
Me too. Me
Oh,
too.
thank you very much.
Okay.